Good evening, all. It's good to be here. And it is 8 p.m. UK time, so it is time to start our live event as we have another interesting topic and another special guest with us tonight. So, today, as you can see, Elisa is with us. Hi, Elisa. How are you feeling today?
Hi, thank you very much for having me here. Thank you everyone for being here today with us. And yes, let's start.
Okay, perfect. Thank you so much. And of course, before we start with Elisa's presentation, let me say a few things. Of course, our Stronger Together initiative has been created so that we can help you out with all of your questions so you can have some insights from top fertility expert, and of course Elisa is one of them. And as always, I just want to thank our ambassadors and partners, but also before that I would like to mention that here at IVF Media we have received a very special award. We are the winner of Best Marketing Initiative, and I would like to thank our experts, our ambassadors, and our presenters for helping us. And of course, thanks to that, we were able to win this award. And of course, it wouldn't be possible if it weren't for you, our patients. So thank you for supporting us through. Also through those months, but also I would like to say thanks for joining our webinars over and over again. And well, I also want to mention the ambassadors and partners. You can see them right here. Without their help, as you know, it wouldn't be possible to simply create this Stronger Together initiative. So as always, huge thanks. And well, today, as I've mentioned, we definitely have an interesting topic, which is approaching different techniques to improve IVF results. And I've already mentioned Elisa Moya Gutiérrez is with us. She is an embryologist at Vistahermosa, and today she will start with her presentation. And remember that you will have a chance to ask your questions. So all you need to do is type the questions in the chat section so that Elisa can help you out. And that is it from me at this point. Okay, Elisa, are you ready to begin with your presentation?
Yes, of course. Thank you very much for the introduction.
Perfect. Thank you so much then, and go ahead.
Okay. So hello everybody, and thank you for being here. Today we're going to talk about different techniques to improve IVF results. So as you know, assisted reproduction techniques have helped many couples to achieve their goals of creating a family. And more methods are being developed to improve pregnancy rates and, as a consequence, a healthy childbirth. Even so, we find some cases of people who need several cycles to achieve this desired pregnancy. These situations can become frustrating for the couple since apparently there seems not to be a problem. Many times, even if the number of embryos is high, the quality is not good, and this can lead to implantation failures or even in some cases, miscarriages. Unfortunately, laboratory techniques are constantly being improved, and with this, we also achieve a better selection of the embryos and even a better development of them. So in this presentation, we'll talk about some techniques that have increased pregnancy effectiveness by 20-30%. So first of all, we're going to talk about how our IVF cycle works without any supplying techniques so that we can later understand better the use of these supplying techniques. So the basic procedure for IVF treatment includes the appointment with the specialist, with a gynecologist that is specialized in IVF, of course. Then the diagnosis of the specific case, because every case is different and every couple needs a different diagnosis and a different protocol. Then the protocol of the treatment, of course, and then the ovarian stimulation. This process can be different also in every case, but we can say that it lasts between 10 or 15 days of medication. So with this treatment, what we want is to increase the numbers of the eggs production in the ovary. So instead of having one egg in one cycle, we can have more so that the chances of pregnancy are higher. The patient has to come to ultrasound control around 2 or 3 times during this process until the eggs inside the ovaries are mature. And then these eggs will be recollected in the egg retrieval process. And the egg retrieval process is a procedure where the gynecologist takes the eggs from the patient. The patient will be under sedation, and it lasts at most 20 minutes, so it's not too long. Then the eggs will be selected by the embryologist in the lab, and once we have all the eggs, we let them in the incubator with a specific media until the sperm is ready, because the sperm sample must be prepared also in the laboratory using a sperm capacitation technique. So depending on the quality and on the quantity of the sperm, we will decide if we make a conventional IVF or a ICSI fertilization. So once we do the fertilization, even with conventional IVF or ICSI, we will have the next day our embryos or our fertilized eggs. And then we will see their development every day in our laboratory, and we will classify them according to theoretical values. If we have a low number of embryos, less than 3, we recommend to have a culture of 3 days and then do the embryo transfer. But if you have more embryos than 3, we recommend to take them to day 5 and then have a better selection of them and do then the embryo transfer. The embryos that we are going to transfer are the ones who have the best morphology or classification. And here in Spain, for example, we can transfer a maximum of 3 embryos, but this is not that common. We always will recommend to our patients to make a transfer of 1 or 2 embryos at most. So one of the topics that we're going to talk about is the seminal quality, and it influences on the embryo development. Seminal quality is a crucial factor when it comes to achieving pregnancy, since it affects both fertilization and subsequent embryo quality. Sometimes we find cases in which a spermatozoa that has been prepared in the laboratory fertilize the ovocytes correctly, but after 3 days of embryo culture, these embryos begin to lose quality. So this happens because the sperm DNA begins to express itself at the day 3 of the embryo culture. So to prevent this from happening, we can use MAX technique. It's magnetic activated cell sorting. It's an immunomagnetic technique allowing the selection of those spermatozoa that do not show signs of cell or DNA damage or even death of the cell, and this is called apoptosis. These damaged sperm can be removed from the sample using this technique because their membranes of these damaged cells contains markers that can be detected, and then we will obtain a fraction that is free of these dead cells, and therefore we have better quality. So as you can see in the picture, this is how MAX work. We incubate the selected sperm with annexine created with a magnetic microparticles, and we make it pass through a column where a magnetic field has been applied. The apoptotic sperm will be retained in the column, while the non-apoptotic will pass through it without being retained. So the fraction that we obtain only contains healthy spermatozoa with the best physiological qualities for our to use in the lab. So we recommend this technique to all kinds of patients because it improves the sperm selection, but it's mainly used and also with medical prescription to male patients with higher age, male patients who have a high level of DNA fragmentation in their sperm sample, patients who have had repeated miscarriages with an undefined cause, patients who have had at least 1 previous treatment cycle or who have poor embryo quality, which is not attributable to the eggs. We could use this technique to make an ICSI fertilization or a conventional IVF procedure. So this non-apoptotic sperm fraction that we're going to use increases fertilization capacity of the sperm and allows to achieve a higher gestation rate, approximately between 10 or 15%. So now we're going to talk about time-lapse. I'm sure you all know about time-lapse. Well, it's a pioneering technique that maintains the culture conditions intact and reduces the handling of the embryo. It allows embryo cell division to be recorded and viewed in a monitor in real time. So we can watch the cell division of the embryos anytime without manipulation. When we use a traditional incubator, we have to remove the embryos at certain hours from the incubator to check the development under the microscope. Although these intervals are very short, the environmental conditions are altered in that time. And so with time-lapse incubators, it offers the possibility to view the morphological and cell division characteristics without the need to remove the embryos from the incubator, so that environmental stress experienced by the embryo is reduced. Okay. As I said, the conventional way of monitoring the evolution of the embryos is to extract the embryos from the conventional incubator every day, and morphological parameters will be evaluated under the microscope. Among them, we see the number of the cells, the symmetry of the cells, and the fragments of the embryo, the total embryo. With this information, a quality is assigned to each embryo. In this way, it allows us to select the best quality for transfer to the material uterus. Time-lapse technology provides highly accurate information throughout embryologic development that allows us to select a group of embryos that have the greatest potential to implant and lead to a pregnancy to term. And in addition, it allows us to explain those cases in which apparently good quality embryos are not implanted. In these cases, we very often discover phenomena that that we couldn't detect without time-lapse and with a continuous or conventional monitoring. Well, time-lapse, this type of incubator can be used for all assisted reproduction patients. We recommend it to all of them, including IVF, egg donation, embryo donation, all of them. But we especially recommend it for those who have a higher number of embryos. This is because when we have more than 2 embryos, the selection of those with the best quality and the highest potential to achieve pregnancy is done with much more precise way. If you only have 1 or 2 embryos that are available for transfer, we could not select them. So we can still use time-lapse, but we're not doing the main action of it, that is the selection of the best embryo. So thanks to the advantages of time-lapse during embryo culture, we achieve between a 10 or 20% higher probability of implantation than using a conventional culture and selection techniques. So now we're going to talk about pre-implantation genetic testing. It's a genetic test performed on embryos produced through IVF always. And it has to be with ICSI fertilization. So PGT-A detects abnormalities in the number of the chromosomes in the embryos, also known as aneuploidies. Chromosomes are very important for healthy growth and the development. The embryos with the incorrect number of these chromosomes typically do not result in a successful pregnancy or may lead to a birth with a child with a genetic condition, such, for example, Down syndrome, Turner syndrome, Klinefelter syndrome, and lots of them more. So embryos with the correct number of chromosomes have a better chance to leading a successful pregnancy, and PGT-A identifies those embryos with the correct number of chromosomes, so our team can select the best embryo with the best chance of leading IVF success. We recommend PGTA to women that are over the age 35, women after 2 or more fate-assisted reproduction cycles, women who suffered 2 or more miscarriages due to unknown cases, women who went through a pregnancy that involved chromosomal abnormalities, and couples in which men's sperms reveals errors during meiosis. So how is it done? How do we do a PGTA procedure? Well, as I said before, we have to do an ICSI fertilization, and then the next day we will see how many embryos we have, how many eggs has had fertilized, and then we will see the embryonic development. Depending on the case, we can have embryonic development until day 3 or day 5. If we have a lot of embryos, it's better to take them to day 5. If we have less of them, better on day 3. At this day, when we decide to do the biopsy, a few cells are carefully removed from the part of the embryo that will form the placenta. And this is the biopsy, the embryo biopsy. These samples are sent to genetic laboratory while the embryos remain safe in the culture, or in some cases, we can freeze them. So in the genetic laboratory, they have all the techniques to analyze the genetic material present in each embryo. And once we have the information of each embryo and which embryos have no abnormalities, these are the ones that we are going to transfer because they're the most likely to result in success. If we have more than 1 or 2 embryos without aneuploidies, of course, we can freeze them for the future use. The advantages of pre-implantation genetic testing is it increases the implantation rate of embryos, and consequently, it higher the chances of getting pregnant. It lowers the risk of miscarriage. It increases the chances of having a healthy baby. And it lowers the probability of going through virus cycles. Okay. So what do we offer in international group UR in Spanish? First of all, we have the secure feed. At UR Vistahermosa, we ensure the safety of all our patients and their newborns. So secure feed combines the union of an in vitro fertilization and the PGTA pre-implantation genetic test. As I explained before, this technique will increase the success rates in IVF cycles and the chances of having a healthy baby at home. Another advantage that we have here in our clinic, UR Vistahermosa, is that it is the only breeding center that has its own genetic unit in the same unit. It is occupied with a team of professionals and offers personalized genetic counseling and consultation whenever our patients need it. So then we have also the guarantee program. It's available with a set price that enables the patient to save money and to get up to 100% refund if the pregnancy is not successful. And to make the process easier for our patients, our guarantee programs have the best condition, and it is the 100% refund guaranteed if there's no pregnancy. Everything is included in the set price, and there are no waiting lists. So what is included? Because I said everything is included, what is included? Of course, an in vitro fertilization, then all the other techniques that can favor and improve the chances of success, as I already talked. Max, ICSI, fertilization, time-lapse, and if necessary, and always with medical prescription, the endometrial scratch. All the medication is also included, and all the embryo transfers. It doesn't matter if it's a fresh embryo or a freezed embryo. So at our clinic, we will always going to try that the couple become pregnant with their own gametes. In cases, because there are cases where this is not possible, we always have the option of egg donation or sperm donation. The egg donation is a treatment in which IVF is performed with the peculiarity that the eggs are from the donor and the sperm are from the correspondent partner. It might also be the case that the sperm is also from a donor. So this is in cases where the mother-to-be has no partner, the female patient has a female partner, or the male partner has a severe infertility. So in other words, donation makes possible the miracle of having a child in women who otherwise could not have children. In the cases when we have to use donation of gametes, we will always use Phenomatch platform. It's an innovative platform, and with it, we as embryologists and the doctors will be able to select the ideal donor for their patients in an objective and scientific way. And how is the ideal donor? Well, it has to have the phenotypical characteristics matching with the patient. It has to be genetically compatible, and the facial resemblance of the patient must be very similar. So this platform allows to provide additional security, minimizing human error in the selection of the donor. And for last but not least, the probability of pregnancy depends every time in every case and on many factors. For example, age, maternal age or paternal age, ovarian reserve, medical and reproductive history, quality of the sperm, and many other factors. Our fertility specialist will prescribe the most adequate and personalized treatment, and our laboratories will provide the most advanced technology to achieve your objective, and that is your healthy pregnancy. So with this, thank you very much. Now I'm ready for all your questions. And there. I think Caroline is, I don't hear her.
Yes, I'm right here. Thank you so much, Elisa, for your interesting presentation. And actually, lots of questions are right here already as well. So thank you so much for that. And are you ready for the questions?
Yes, of course.
Excellent. I'm glad to hear this. And well, let's have a look at the very first question that we have right here. And the question is a frozen sperm enough for ICSI, or is it better to take a fresh one?
Yes, frozen sperm is very, very enough for ICSI. When we do ICSI, we just need these sperms, this spermatozoa that we're going to use for fertilize. So if we have 5 eggs, we just need 5 good spermatozoa. So a frozen sperm is enough if the patient has a good sperm and not a severe condition. So yes, it's enough.
All right. Thank you so much for your first question, and of course, Elisa, for your answer to that. And the next question is also right here. Is this method of Max new? I have never heard of it before.
Well, it's not new. Maybe it has, I don't know, 5 or 6 years, 5 years. We use it all the time in our clinics, and it's working very good. So we can say that it's nothing that it just happened, that just came out. It's something that we've been using for a few years, and it's very good.
All right. Excellent. Thank you for this as well. And actually, there's another question in regards to Max. So, does other fertility clinics use this method, or is it a new method used only by your clinic?
I think I can pretty sure say, I think there are other clinics that use it. But of course, not everyone. Every clinic is different. Every clinic has different protocols. I think they use it, but not everyone, of course.
Of course. Understood then. Thank you so much for that. And we have another question. This time on embryo glue and embryogen culture. What do you think about those?
Well, embryo glue works very good. We use it at our clinic, and it's been scientifically proved that it helps to make the implantation in the endometrial. So we use it and we recommend it every time. Embryo gene culture. I don't know what this is. Embryo gene. I have never heard about it. No, so I can't say anything about this.
Of
Sorry.
course, no problem. Thank you so much again for your question and your help with that. And now we
Mhm.
have a bit of a longer question. Okay, so of course I
Okay.
will show you and let me read it to everyone. I have
Okay.
gone through IVF in 2019, February, April, May, and January 2020. 18 eggs were retrieved and 12 embryos developed in February. First transfer was done on day 3 after ovum pickup and using 3 fresh embryos. In the next 3 attempts, embryos frozen the first time were used. I have endometriosis and PCOS. I recently got done pelvic MRI and hysteroscopy. Both show adenomyosis. Ovaries are fine. What could be done to improve embryo quality, increase chances of implantation? I understand that both PCOS and endometriosis cause problems in IVF success.
Well, of course, I mean, every case has its own complications, and there's a lot of factors that are involved in a pregnancy. Not only the eggs, not only the sperm, also the uterus, the endometriosis, of course, as she has said. So the best thing is that she has that Anishka has a private Skype with a doctor and tells her the best thing that she can do. She has, of course, 18 eggs and 12 embryos. It's a very good cycle, but maybe there are other things that here are missing. So it's better to talk here in a private consulting with a doctor and to see this better, this
Well,
case better.
all
Okay.
right, of course, understood. Thank you so much. And I will send you a link. You can actually use it. And there's an option to get in touch with the team, Vistahermosa team, and I'm sure they will be more than happy to help you out and provide more details. Yeah. And
Mhm.
there's a thank you actually from the patient Anishka right here. Okay. And in regards to the previous question, when it comes to embryo glue, could you explain what is it?
Yes, embryo glue is a medium that we use that have some specific qualities that we use it before doing a transfer. So the embryo will be in culture, in a normal culture, during the 5 days or the 3 days. And then before we do the transfer, we leave the embryos in embryo glue for about a half hour, because the embryo glue has a specific technique. Well, technique, no, it has a specific material that induces that the embryo can attach better to the endometrium, to the uterus. So it's proven that it helps, and we use it a lot every time, and it works very good. So yes, I hope I have asked respond good this question.
Wonderful. Thank you so much for explaining that, of course, as well. And let's have a look, okay? The next question, not sure, okay, if you can answer, but let me show you. How much is the guarantee program?
Oh, okay. I couldn't say it. For it depends of what technique, of course. This is more. I mean, it can last. I can't
Of
really say. If you can have a Skype with our doctors or email, and our doctors will tell you exactly how much the set price is.
Of course, that's perfectly okay. As I mentioned, you can use the link, and there, I'm sure the team will be more than happy to explain everything with details and the prices there as well.
Yes, yeah.
Okay, thank you so much. And let's have a look, okay? Next question is all right here as well. We have had sperm sorting after having a DNA fragmentation test. Is that the same as Mac's method?
Well, it's different. Sperm sorting, we don't use it. What we do is capacitation of the sperm, which is having only the mobile spermatozoa. And then after that, we do the max. Sperm sorting, we don't do it, so I couldn't tell you about that.
Of course. Again, thanks so much for answering that. And there is one more question here. What do you think about assisted hatching?
Okay. Well, yes, we used to do that. We don't do it anymore. It's not that it doesn't improve that much, the implantation failure. At least it's that what we have seen in our clinic. Of course, there are some embryos that could help, but the embryos, if they have a good quality, they have the capacity to make their own hatching and implantate for themselves. So we don't really believe in this technique, but I mean, it can help. Yes, of course, it can help, but we don't do it.
Okay, thank you again for that. And next question also is ready, and let me show you. It's I would like to know what would be the best choice: frozen egg donation or fresh egg donation. What are the chances of implantation in both cases?
Okay, it's been studied that there is no difference about frozen egg donation or not donation. There's no difference about frozen or fresh. Both of them are good. Both of them have the same implantation rates, and so it doesn't really matter. And both of them are very good. So we use both of them, and none of them has a better rate than the other or a better chance. So we recommend both of them. It depends on the patient. If she is at the same time with the donor, then we do it on fresh, of course. If with logistical issues doesn't work, we do frozen egg donation, and there is no difference.
Okay. Again, thank you so much for your question and your assistance with this question as well. And let me have a look. Of course, there is one more right here. And what do you think about endometrial scratching?
Well, it's a good technique. It helps, and always it does help, but it should be with medical prescription. So to do it just because it helps, as every technique, it's not really recommended. It should be done when the doctor says that it would help. So it's not for everybody, but it would help. If your doctor says that it will help you, I would totally do it. So.
Okay, thank you for that as well. And of course, more questions are coming up, and let me have a look at the next one. My last IVF was straightforward. I took my progesterone and estrogen as suggested at the time required. I have blood pressure and underactive thyroid, which is under control. I also had a check to see if my uterus was healthy for implantation. Sadly, the embryo did not stick. I'd like to know what would be the next best way to ensure I can have a more successful IVF treatment. I'm 47.
Well, of course, as I said before, every case is different, and it's better to see the case with more details. Well, as I see here, it was one embryo. Okay, that could be. No, I mean, if it's your first IVF, it's normal not to get maybe the first time. So maybe there are some stuff that we are missing here, and some other techniques that maybe could help in a more medical way, not embryo way, because maybe the embryos were good, but maybe you need some medication, or you need another because of the blood pressure and the thyroid. So I don't really know, and this is better to talk it with a doctor, because he knows the health, the complete health of the patient, and I think this is the best way to know what's better for everyone.
Understood perfectly, of course, as well. Thank you for this. All right, and of course, there's a thank you from patient as well. Okay. Just a second. Okay, sorry. There's like a follow-up from the patient. I had a double donor frozen embryo transfer, by the way, and I would like to explore different ways. Anything you can add to that?
Well, it's well, if she had a donor, a sperm donor, and egg donor, that's the best way to get an embryo. But as I said, maybe the embryo, everything is so correct. What we have to see now, it's the health of the uterus, the health of the endometrium, and the analytics and everything that can influence in the implantation.
Okay, perfect. Thank you so much for that. All right, and let's have a look at the next question. What is the maximum gonadotropin dosage at the clinic?
Well, the maximum can be. We don't give too high doses. At most 300, 350. So we don't want to give too much doses of gonadotropin.
All right, perfect. Understood, of course, again. Thank you for that. And let's have a look, okay, at the next one. And here it is. I have gone through 2 unsuccessful IVF with 2 eggs every time, but the implantation fails. Do you recommend egg donation? I have AMH 0.90.
Okay, the EMH is a little bit low, it's true, and it depends how the eggs were when you did the IVF, because maybe you have 2 eggs, but 2 embryos, sorry, but they weren't in a good quality. It depends on the quality of the embryos that you had the transfer. If they were very good embryos, then I would maybe try it again. Depends also on the age of the patient. If not, you can directly go to donation eggs, and of course the probabilities will be better.
Okay, again, thank you for that.
Okay.
Next question also is ready. Is a 5 mm polyp okay to do an embryo transfer?
Well, it depends where this polyp is, of course. If it's in a place where the embryo, it's more difficult for it to implant, then of course it will be not okay to do the embryo transfer. It depends where it is. It depends where the polyp is. And of course, this is more medical question, so I don't really. As I said, I prefer that these questions are more with a gynecologist, because I can say to you maybe yes, but I'm a biologist, embryologist, so I don't really want to get much into this.
Of
And,
course, that's still okay.
okay.
Of course, thank you so
Okay.
much. And yes, we are always remember that you can always get in touch with Elisa and her team, and of course they will be able to give you a proper answer from a gynecologist. So we can do that, of course.
Yes.
Excellent. Thank you so much. And now we have another question, like in 3 parts. Okay, so let me start from the
Okay.
first. So I'm 42.
Okay.
I had 5 cycles of IVF, started last year, August. First 2 embryos transferred successfully, successful pregnancy, which ended in miscarriage week 9. Then again, next cycle, 2 embryos, negative result. Again, 3 cycles, the same. Fourth, ovulated before eggs could be transferred, embryos, not good enough quality to freeze. Following cycle, 11 eggs, 4 embryos transferred, negative result. 2 embryos were day, 5 blastocysts, and 2 not great quality to freeze, so they were transferred. Question is, what should I do to improve egg quality, and what other procedures could help with checking what else is required to have a successful pregnancy? I have Hashimoto.
Okay, I'm sorry to hear that because it's a lot of cycles, and I know psychologically it's very difficult. Well, first of all, yes, maybe we should see the quality of the embryos, of the eggs. Sorry, if these are not good, well, one option is to do. Yes, I know. One option is to do egg donation. I know it's tough sometimes to assume this decision. And on the other hand, maybe if you accumulate embryos and then do a PGTA for not having miscarriages, or for avoiding these implantation failures, because maybe you don't know if the embryos that you are transferring are genetically okay. So maybe they look good, but maybe they have aneuploidies. So this could be one option to do PGTA. And if this doesn't work, I would recommend the donation of eggs. But of course, it's better to see the case specifically.
Of course. Sorry, there's a follow-up. Okay, so let me just show you. I was thinking about that. I never did PGTA. Doctor never suggested that.
Well, this could be a reason, because miscarriages are one of the aneuploidies are one of the most common causes in miscarriages. So that's why it helps. It helps to make a more screening of these embryos. And maybe you have a good embryo, but if you don't know how the genetics are, it doesn't get to a pregnancy. So maybe this could be one solution, but of course it's better to be informed with your doctor, with your team, and what they can suggest to you.
Okay. Again, thank you so much. And there's a thank you, of course, from the patient as well. And from the previous one, okay, as well. Sorry, I forgot. Thank you so much. And let's have a look. Of course, there are more questions coming up. And I was looking into coming to Spain for my first IVF. I am 42 and a half. Then my levels have come in at 49 AMH. I would still like to try one attempt of IVF at the minimum. What are the laws in Spain of my sister donating her eggs? So a known donor but family would be using donor sperm.
Okay. Yes, of course. I mean, you can try it once. I mean, I think everyone wants to try it with her own eggs, and sometimes it helps, even if your AMH it's a little bit low. You can try it. If this doesn't work, donation, it's always an answer for this type of cases. But in Spain, donation are totally anonymous. So you can't choose the sperm donor or the egg donor. So it would be totally anonymous. We use this phenomatch, as I told in the presentation, and we take this donor that is the most similar to the patient, and genetically and physically and with everything. So we try that it's really similar to the patient, but it's anonymous. So maybe this is not what you're looking for. I don't know.
Thank you for the clarification. And of course, if you would like to ask any other questions, just go ahead and type this in, or just get in touch with the team. And well, there are like few questions left, so we will be finishing slowly. However, if you have any, just go ahead and type those in right now. And let's have a look at the next question. So does having a flipped uterus, as in it is more farther back, does that impact the embryo implantation?
Well, it can, of course, but again, this is more a medical question. I don't really want to get into it because it's more for a gynecologist, I would say.
Understood perfectly again, of course. All right.
Okay. I'm
Thank you
sorry
so much.
for that, but
Yes, of course, we definitely want to make sure that you have a proper answer. And of course,
of course.
Elisa is the embryologist, so please remember that as well. But don't worry. I mean, if you would like to get some more details,
Yes,
Vistahermosa team will be happy to help you. I
of
am
course.
sure.
Our team, I mean, we have a lot of doctors in our clinic, and they will be happy to answer all these questions.
Exactly. Thank you so much. Okay. And in the meantime, one more question is right here. So I have had 4 ICSI cycles with donor eggs. 2 transfers resulted in negative, and 2 transfers resulted in pregnancy but miscarriage. Would you be concerned as donor eggs have a better success rate?
Yes, well, they have, but maybe here, I don't know if the sperm was from the was another donor or the sperm. Okay. Well, maybe here it's good to make max or okay. Okay. Um, or maybe to do a PGTA also, because maybe if the sperm has abnormalities, it can influence on the genetics of the embryos. So maybe here there is a genetic problem. Of course, we would like to know which quality this embryos has, because maybe they were bad quality. I don't know. If they were good quality and it did fail, maybe I would recommend to do a PGTA, knowing the information that I have. Of course, if we have more information, we can know better the case, but knowing this information, I would recommend PGTA or max technique.
Okay. Thank you for that advice. And they were good quality. This is a
Okay. So maybe
especially
there is a genetic problem.
all right. And again, there's a thank you from Pamela. Okay, and of course, let's have a look. There are a few questions left once again, so let me have a look. I was meant to do frozen embryo transfer, but on the day of the transfer, the embryo had not survived. When and why does this happen?
Well, this can happen. This is something that sometimes can happen because, well, the embryo has to have a very good quality to survive the frozen, well, the freezing. And also sometimes if it's very good quality, sometimes it can happen because freezing, it's aggressive. Well, it's not aggressive, but I mean, it's, you can understand that some embryos can survive it very good, but there are other ones that they don't survive it. They can do it, and we can't really explain why. One of the reasons is because maybe they freeze a not so good quality embryo, and other times it happens, and nowadays we don't know why. But this is a little bit of a risk that can happen, but the most of the time the embryos survive the frozen. So maybe next time will be better. So I hope so.
Mm-hmm. All right. Again, thank you so much for that. advice. And let's have a look. There are like 2 questions left. So again,
Okay.
let's have a look. Can 8 millimeters intramural fibroid affect pregnancy?
Well, yeah, I think it can, but of course, this is again a gynecologist question. I prefer not to answer that. I think it can affect, but I don't really know. So I prefer that this is more for the
For
gynecologist.
more details, yeah. So of course, it would
Yeah,
be better to ask a gynecologist. So of course, please keep that in mind. But I'm sure the team will be happy to help you out
of
with
course.
that question as
Yeah.
well. Okay, and there's another. Sorry, there's also follow up from the previous patient. Like, yes, I have
Okay. Okay. Yes.
And let's have a look at the question. I would like to know if the ovarian rejuvenation is an option for women with very low ovarian reserve.
Rejuvenación, eso es el. No, no lo hacemos. We don't do. No tienen una evidencia científica. We don't do that because it doesn't have any scientific evidence. So we don't do it. We
Okay, sure.
okay.
Thank
Yeah.
you. Thank you for that, of course, as well. And well, this is a question that comes up quite a lot. How can we improve the quality, egg quality?
Okay. Well, here there's a lot of factors. We can improve if the sperm is very good. We can. Oh, and the eggs. Sorry, I have read the embryos. Okay, the egg quality. Well, it depends of a lot of factors. The age, the genetics, the lifestyle that you have, and we can really do something for improve that a woman can have good egg quality, because we as women, we are born with the eggs, and during the time and after a few years, the eggs quality start to lose, well, the eggs start to lose quality, and this is how it is, and we can't make it reverse. So we can't really say anything about this. We can say that maybe the style life can help, but the most important thing is the age and the genetics.
Of course, thank you once again for that. And let's have a look. There's it looks like it might be our final question, but of course, if you have any questions, then just go ahead and type those in. We will be finishing soon. Can you say something about the immunology between the donated eggs and the receiver? Is it possible that some women are immune for donated eggs? Can this be tested?
Well, nowadays it can't be tested. We can say that for sure. It may affect. There is no scientific evidence about it because, as I said, nowadays we don't really. There are many factors that we don't know. We try to work with the factors that we do know, and that the factors that are scientific proven. But in our experience, we see that they should not be a problem with the immune system. So we always try that the genetic is compatible with the receiver. So, and we don't have many problems with that. So that wouldn't be a problem nowadays that we can say.
And again, thank you so much for that. And yeah, in the meantime, 2 more questions are right
Okay.
here. So, what do you think about pregnenolone? I'm not sure, or DHEA? Pregnenolone, I guess.
¿Ves? Esto, we don't use it. I don't think prenolone. I don't think we use it. ¿Pero cómo es? No. Prednisolone is that what we use, but I can really say something about DHA or pregnolone. Sorry.
Okay, of course, understood. And we can always, again, just you would need to provide us some more details, and we can always send this to the team. Yes, so
Yes,
to double
of
check it.
course. Yeah.
That's of course possible. And one more question is right here. So do you test your donors of HLA?
HLA is this the same in Spanish? What is HLA? If you could explain, because maybe in Spanish it's different, and I'm not really.
Mm-hmm. Yeah, if you could just give us some details on that to make sure, so that Elisa
Oh,
can.
okay. Yes, we do it. We do it. Yes, of course. We
Mm-hmm.
do test them. Yes.
Okay, all on the of the donors. Yes.
Yes.
Okay, good.
Yeah.
And again, there's a thank you from Joanne.
Okay. Mhm.
Perfect. And if you said that right, that you use prednisone for.
Well, this is again a medical prescription, right? And we do it for increasing the success, well, the implantation rates, the success of implantation rates. But of
And
course,
wonderful.
it's medical indicated. It's medical indicated.
All right. Again, thank you so much for that. And at least at this point, we do not have any more questions. And in such case, we will be finishing. But again, let me just mention that if you wish to get in touch with Vistahermosa team, Elisa and her team, I'm sure they will be more than happy to help you out with some more of your questions, and so that you can get some more details. And we will be finishing for today. So, everyone, thank you so much for joining us tonight, wherever you are. I know that some of you might be actually, it is like midday for them. So I'm happy that you've decided to join us, and I believe it has been very useful to you. Lisa, thank you so much for joining us tonight and for your
Thank you too.
presentation, as well as assistance with all the questions. And is there anything else you would like to add?
For me?
Yes, if you would like to
Yes,
add anything.
I just want to thank all the patients for being here today. I hope they will become pregnant soon and that their wishes are going to be resolved. So I really wish the best for them. We are here for help you. I couldn't answer a few questions of gynecology, but our team are very specialized and they can help you anytime you want.
Excellent. That's very. What else can I add? Yes, fingers crossed to everyone for
Yes,
sure. Best of luck.
yes.
And of course, as you can see, there are like more thank yous coming up. So I definitely want you to see them. Greetings from Munich, and thank you.
Oh,
Thank you
thank
very
you.
much for all your information.
Thank you.
Thank you. It was very informative, and some hugs from London.
Okay.
And of course, greetings from London as well.
Thank you very much. Thank you
Thank
all
you.
for
Thank
being
you
here.
so much. And just remember that, of course, there's one more. Thank you so much from Germany. You are so nice.
Oh, thank you very much.
Thank you, everyone, for all those kind words as well. And I believe it has been very useful for you. And as always, remember it has been recorded, so it will be available tomorrow on our website, myivfenses.com. And if you subscribe to our YouTube channel, you will be notified that when the new video is uploaded. And of course, you can find all the rest of the events on our site. And if you go and check our Facebook page and Instagram, there are you will see, sorry, you will see all the events coming up. And of course, we will be back tomorrow at 8 p.m. UK time. So I hope to see you as well. Have a wonderful evening or day wherever you are. Elisa, thank you so much again. It has
Thank
been a
you.
pleasure to have you here. And again, you also have a very nice evening. And take care, everyone. Thank you. Good night.
Good night.
Bye.